Okay, I don't know if it's just me, but it feels like everybody's talking about facelifts lately. Anyhow, it inspired me for this new series. I'm going to explore all the options that we have to look our very best in our 50s and well beyond, and I'm going to take you inside some of New York City's top providers to explore both surgical and non-invasive techniques. Today I'm having a consult with Dr. Sean Alemi, one of New York City's next generation facial plastic surgeons.
A facelift is like something that, number one, you have to want, but then again, physically and emotionally you need to be there, and yes, then you can benefit from a facelift. You can have a facelift if you want to, but nobody needs a facelift. I make that very clear. This is not a need, this is a want. It's like I exist in this small little stratosphere of medicine where nobody actually needs the services that I provide.
True.
So, and I try to be very aware of that. But, if when I'm going to examine you, but from what I see from your face, I think you could benefit from a facelift. There's enough laxity there, but those people aren't wrong. They're saying that you look great. And this is the thing about aging, it's deeply personal. So, I just like to kind of get to know you a little bit and understand what you're hoping to accomplish with your consultation and what your goals are aesthetically, what you're unhappy with your face. And
I don't like this. It's making me very unhappy.
Okay. So, when we talk about lower facial aging and neck aging, what we're really talking about is a facelift. A facelift is the most comprehensive way that you can restore your appearance back to what it was like 10 or 15 years ago. And when we talk about facelifts, what I do, my technique of choice is a deep plane. And I like deep plane surgery because I think it gives us the most ability to get the maximum result, creating the least amount of distortion in the face. I mean, everybody wants a fantastic look but doesn't want to look plastic. And to me, deep plane intersects all the things that people want and leaves out the things that are undesirable, like changing of the earlobes, scars that are visible, hairlines that shift, the pulled tight appearance. It's some of it's technical and some of it's aesthetic judgment by the surgeon. But when you're seeing what you're unhappy with in the lower part of your face, this is all facial laxity. So a vertically vectored deep plane facelift is going to address probably 90% of the things that brought you in here today. I always combine that with some deep neck work to create more depth under the jawline. There's muscle that needs to be contoured, there's fat, sometimes there's other tissue that needs to be sculpted in order to create that depth, restore that sort of tight, defined, beautiful jawline that is probably very characteristic of, 10 years ago for you. And